Hello everyone, I'm registered psychotherapist Joelle Anderson, and this is Kernel of Wisdom. Have you been looking for help and finding yourself really confused by the different titles out there? What's the difference between a psychologist versus a social worker versus a registered psychotherapist or the other practitioners available? Today, I'm going to break it down for you a bit. Okay, so let's start with the basics. Usually when someone is looking for someone who works in the psychology field, they're looking for one of three things. They're usually looking for some sort of talk therapy. Maybe they need an assessment or a diagnosis, or they're seeking medication. So the first thing to know is any of the practitioners I've mentioned, a psychologist, a psychiatrist, a social worker, a registered psychotherapist, they're all qualified to deliver talk therapy. And usually that includes any of the popular modalities out there, anything from cognitive behavioral therapy or CBT to dialectical behavioral therapy or DBT, or specialty training in things like eye movement desensitization and reprocessing or EMDR for trauma. Essentially what happens is as soon as one's baseline psychology education is done, you engage in a bunch of trainings in these specific modalities. And any of the practitioners that are licensed are usually capable of going to those trainings to learn more about those modalities. The irony is, at that point, we're all literally in the same room together learning the same information. So the techniques being applied are usually the exact same. And so it's the personality or the actual style of the therapist that matters more than their title. So if you're looking for a practitioner just for talk therapy, I really recommend just focusing on what modalities they're trained in, and if you get a sense that you click with them. What research shows is the number one consideration in terms of what helps people get better from therapy is what's called the therapeutic relationship, or how you click with your therapist. Okay, so that's what's the same about these practitioners. Now let's talk about their differences. So when it comes to differences, the two main factors are the baseline education that someone receives and what their license says they're allowed to do or not. Okay, so a psychiatrist is a trained medical doctor. They go to medical school, and that's why they're usually the only ones that are allowed to prescribe mental health medications. For basic medication, sometimes your family doctor or a nurse practitioner can also prescribe those, but especially if you need a specific mix or are dealing with more complicated neurological conditions, then a psychiatrist might be involved. They technically can offer talk therapy, but it's pretty rare, especially depending on where you're living. A lot of psychiatrists have just 15-minute bookings back-to-back to review medications and mostly focus on medical monitoring of those medications. But some of them do offer talk therapy, and a lot of them can be very therapeutic, even when they're just focusing on medication. But some of them, that's not their jam. And so with your psychiatrist, just know that that might be the limit. Okay, so at least in Ontario, Canada, where I am, and in many parts of North America, a psychologist usually needs to have a PhD in a psychological field. And because they've done a PhD, they often have a specialty area that they focus on, though not always. A lot of psychologists offer talk therapy, but depending on where you live, they might also be the only option if you need an assessment or diagnosis. So for example, in Ontario, Canada, where I am, you need to be a psychiatrist or a psychologist to give out a diagnosis, or you need to be supervised by one. Some insurance companies will also only cover psychologists. And just know that sometimes because they're so educated, they may cost a little bit more, but it's that education and the degree of expertise that someone is paying for. Okay, and that leaves us with registered social workers and registered psychotherapists. If both exist where you live, then usually both have master's level degrees. It's just the type of degree. A master of social work will become a registered social worker. A master of counseling psychology or psychology will become a registered psychotherapist, or sometimes a registered counselor, depending on where you live. They generally can't do assessments or diagnoses without the supervision of a psychologist or a psychiatrist, and they generally can't prescribe medication, but both can do all of the talk therapy treatments that they're trained in, the same way that a psychologist or a psychiatrist does if they do talk therapy training. The benefit is that they often can be quite skillful and are a little cheaper than some of the more educated groups. A social worker might do more of what's called case management, or linking their clients with resources in the outside world, like housing resources or legal resources and that kind of thing. A registered psychotherapist is usually more focused primarily on the talk therapy modalities. And some of them might have really specialty training as well. For example, I'm a registered psychotherapist, but I have specialty training in a bunch of trauma modalities or eating disorders. Those are two pretty specific fields. And that brings me to an important caveat. I'm obviously coming at this video as a registered psychotherapist. So this is my understanding of these different titles, their different roles, and really each person has crafted their own career and their own experience. So really look at the therapist, at the person you're looking into most of all. Ultimately, I just hope this video gives you some guidance on how to proceed if you're looking for therapeutic help. And again, remember, my ultimate recommendation is to pick a person you feel like you can talk to and trust. And it's always good to double check and see what your insurance covers as well. Otherwise, if you have any questions, feel free to drop them in the comments. Don't forget to like and subscribe for more psychotherapeutic information or mindfulness exercises or other tips on how to manage emotions. Otherwise, take care and be well. Bye.